alcoholism and alcohol dependence medication. There are 3 anti-alcohol drugs available: antabuse, disulfiram; Campril, acamprosate; Revia, naltrexone. I will begin with antabuse, since it is the most well-studied. Disclaimer. Important: this is general medical information, and is not tailored to the needs of a specific individual. How medication helps alcoholism treatment and recovery. Antabuse works by making you sick to your stomach if you have a drink. It works because if you know you can't drink, then you won't think about drinking as much. Antabuse reduces cravings for alcohol. Antabuse reduces the risk of relapse. People who use antabuse feel liberated. That internal struggle that goes on every day, will I drink? Won't I drink? Is silenced when you're on antabuse. Because drinking is not an option, you don't waste your time thinking about drinking, and instead you focus more on your recovery. Antabuse is effective, because you have to wait for 1 to 2 weeks before you can have a drink after you stop antabuse. You can't stop antabuse one day and have a drink the next. It gives you plenty of time to reconsider, restart your antabuse, and ask for help. Antabuse is a bridge between your 2 lives. On the one hand, you have the life that you know. It's not what's good for you, but it's what you know. On the other hand, you have the life that you want to get to. It's better for you, but you don't know how to live there. You don't know how to relax, reward yourself, and celebrate without using drugs or alcohol. Antabuse helps you live in that life long enough so that you can develop new habits and coping skills. The antabuse reaction. It takes 1 drink to produce a reaction. It takes 1 bottle of beer, 1 glass of wine, or 1 shot of liquor to become sick. The normal sequence of the antabuse reaction is: flushing of the face, headache, low blood pressure, racing heart, dizziness, nausea and vomiting. If you have 1 drink, you will vomit about as much as if you had food poisoning. The do's and don'ts of antabuse. Wait at least 24 hours after drinking before starting antabuse. Consider the following arithmetic. If you had 10 drinks and weighed only 100 pounds, 45 kilograms, the alcohol would be completely eliminated from your system in 24 hours. If you weighed more than 100 pounds, 45 kilograms, it would take less than 24 hours. Bloodalcoholcalculator.org. For most people, it takes 1 drink to produce an antabuse reaction, therefore it's hard to get by mistake. You can have foods that have been cooked in wine, as long as they've been cooked the alcohol evaporates quickly. You have to be careful of some desserts that have a lot of uncooked alcohol in them. You also have to be careful of some cough syrups and cold preparations that can contain as much as 40% alcohol. Most people prefer to use non-alcoholic mouthwashes to be on the safe side. Although the amount of alcohol you absorb from mouthwash doesn't equal 1 drink, assuming you don't drink your mouthwash. Antabuse side effects. The side effects of antabuse are less common than the side effects of relapse. During the first week or 2 that you take antabuse, you'll probably feel a little more tired. It usually lasts for a week or 2 and then it goes away. During the first 2 months that people take antabuse, about 20% develop a funny taste in their mouth. It's usually described as a metallic taste. 80% of people don't get it, and if you do get that taste, it often goes away after a few weeks or months. That's it for the minor side effects of antabuse. Before taking antabuse, you should give your doctor your entire medical history. You may not be able to take antabuse if you have a significant medical history of heart or blood vessel disease, diabetes, an underactive thyroid, brain disorders, for example, seizures, brain damage, kidney disease, liver disease, a history of severe depression, a history of psychosis, or a history of suicide attempts. Antabuse can alter the metabolism and blood levels of certain drugs, especially tricyclic antidepressants, dilantin, phenytoin, comain, isoniazid, and theophylline. Do not take antabuse if you're pregnant, or trying to become pregnant. If you notice any of the following rare but serious warning signs, stop using antabuse and tell your doctor immediately: dark urine, severe abdominal pain, persistent nausea or vomiting, yellowing of the eyes or skin. Getting a prescription. Speak to your doctor about antabuse. Antabuse is available at most pharmacies. If you are a Canadian resident and your doctor cannot find a pharmacy that dispenses antabuse, it can be ordered through www.pharmatar.online, which is an internet pharmacy that delivers free of charge through Canada Post. If your drug plan does not cover antabuse. Antabuse is a simple drug that can be made by a compounding pharmacist. Therefore, if your drug plan does not cover the cost of antabuse, you can sometimes have it made relatively cheaply as long as you have a prescription. The monthly cost is usually much less than the price of alcohol. Studies have shown that antabuse is at least as effective, and sometimes more effective than the other two medications, which have only been around for a few years.